So Alex, thanks for presenting. We talked about Tarlov cysts and turned it into a conversation around scope of practice and collaboration. Briefly, what is a Tarlov cyst?
A benign pathology. It's a fluid collection that traces along the central nervous system. Tarlov cysts specifically primarily found in the sacrum, and they involve a portion of the nerve root. So the cyst itself is in the sheath, but the defining characteristic of that specific pathology is that the nerve root is involved as well.
And how common are they?
They are in the population. We see them in our clinic anecdotally. We do see them quite often. Statistically, probably less than 10%, maybe 5 to 9% in the general population. But of those, probably only, maybe 2 or 3% are actually symptomatic.
You've been working with me for several years now.
Yeah.
And I think I've probably seen dozens, maybe even hundreds of patients that have Tarlov cysts.
Yep.
How many have we operated on?
We have not operated on one yet. Yeah, that's the interesting thing is, yes, they can be symptomatic. It can be a problem. We see them on imaging quite often, but traditionally not a surgical problem.
So this patient has a really large Tarlov cyst.
Yeah.
It's eroded the sacrum, and it has caused pressure on the nerves, causing radiculopathy, and it's affecting work, can't sleep. So, and we've never even operated on a Tarlov cyst, let alone one that was very big and complex. So what could be done?
That's the hardest question, because in medicine, generally speaking, we're here to be helpful. We want to help people. Somebody comes to the office, they make the effort to make an appointment. There's usually a copay or whatever's involved financially as well. So people are actively seeking help, and then they come to us and you feel a little bit handcuffed that you don't have a great way to be helpful. So that was a big point of the discussion today, was really collaborating with all the different specialties in the community. What are other interventions available to help this person? And then ultimately, when is it appropriate to really define your limits as a provider? Where do you stop and say, this is probably as far as I can go to be helpful for you, unfortunately?
I think in every case you can learn something. So the patient comes in, it's a pathology or a problem I'm not familiar with. It's always a good opportunity to read up on it, to understand it better. But I think you want to be cautious going in and doing something, especially with surgery, when it's outside your comfort zone or it's beyond your limits, and it's impossible to be an expert surgeon on everything.
Right. Yeah, you can't always be every answer for every patient. There's not just one person that can solve all the world's problems. But it is a delicate balance, because you don't want to just reflexively punt and kick every case out the door to let somebody else try and manage. But you also have to know when that is appropriate.
Yeah. I was thinking it brings a lot of logistical issues up, because if you've got a patient in clinic and you don't have the right answer for them, or you know that they need to see another specialist, that's a tough conversation to have, because the patient's sitting there thinking, you mean I have to schedule another appointment? And oftentimes, if it's another neurosurgeon, wait a few weeks maybe to even see them. Yeah. And then more time from there to have any kind of intervention. And that's a challenge. It's real. It's not like this simple thing. That's what I love about the discussion. It's not a simple thing that you just send the patient or talk to a colleague and they immediately are available and give an answer and treat them.
Yeah, I think a little bit underappreciated. I think for some reason that's the perception in the community, is that we all just talk to each other every night, and that we easily share everybody's health information across every platform, and everybody's imaging studies are widely accessible. But there's a lot involved in that, and it's not so simple to just say, go see so-and-so next door and you can see them later today and they'll have access to all your information.
Yeah.
It's a complex situation, I think, is underappreciated.
So for the patients, maybe there's a little bit of an understanding that needs to happen there, that we will be honest with you about what we are able to offer. And then if another person needs to be involved, the realization or the recognition that it's not always the easiest thing, even though it's the right thing. There's a lot of complexity to it.
Yeah, there's a lot of logistics involved, and it's understandable. I can definitely see that from the patient's perspective, because I get a fair amount of conversations in clinic where somebody probably, by the time they get to our office, a lot of times they have been through 2 or 3 other specialists. They've worked with their primary care provider. Some of them have been through multiple rounds of conservative treatment options with therapies and injections and what have you. And then they feel like, or they have the perception that they're making it to probably the end all opinion, that this is the end of the road. I made it. And I can see that's a difficult conversation and a difficult message to receive of, well, actually, I think there's more steps to do.
Yeah, that's hard.
It is.
I think too, this particular patient had a surgical problem that needed the right surgical expert to get to, which in some ways is simpler than a patient that has been to everybody and then told there isn't a great surgical option. And that really does feel like the end of the road.
Yeah.
And that's tough. That's a hard conversation. But we don't want to operate on somebody that we don't think has a very good chance of getting better at the same time.
Yeah.
So again, we're not going to recommend surgery when we don't feel confident it'll help, or at least has a good chance of helping, and also feel good about our capability of doing it.
Yeah, and it does get difficult because there's definitely a logistical and a scientific lens to be looking through this, but also an emotional piece. When you get somebody that's sitting in front of you and talking about their struggles and their difficulties, just emotionally, you want to be helpful for them. But you also have to be a little bit more objective and make it a very basic risk versus benefit analysis. Of our options to intervene, the risks are going to be what they are, and what's our proposed benefit, and how do those weigh out against each other?
I think that some people could be a little bit critical, actually, of the way that we manage patient care, at least our team, because I'm not actually physically in clinic very often. You're the one that's in clinic most of the time, or Tyler or Lindsay or Brandy.
Yeah.
And there's some reasons for that, and it's not a simple answer. But I've gained an appreciation for the value of being a little bit distanced from all the emotion and looking at the objective data and making a clinical opinion.
Yeah.
I found that if somebody's physically in clinic pushing you in a direction, the medical decision making is not as good.
That's true.
And so, yes, we definitely want to see people face to face. We always try to see them in clinic prior to going to surgery. I see them before surgery, after surgery. But when somebody is seeking an opinion from a surgical expert or an expert, getting in quickly is very valuable. So by allowing people to come in and see you in a couple of weeks, or sometimes it's even gotten as long as a month, is better than if they were to come in and see me and it would be 3 or 4 months.
Yeah.
And then you can get their story, you can get their history, and understand as much about their problem as possible. And then I can look at it when there's no time constraint. I could look at it and not be sure and look at it the next day. And there's no emotion, at least pressured emotion, or somebody sitting in front of you saying, I need an answer, and you start changing your framework to be like, I need to give you an answer, even if it's not the answer I would normally do.
Yeah.
And I think there's some value in that too.
Yeah, I agree. I liked your message not too long ago with our newsletter that went out talking about be still and in the moment. And you really got to remove yourself from the stresses and the outside influences to make a good clinical decision.
Yeah.
So I think it's a good model. I agree.
Yeah. Good surgical care is a combination of operating on the right people and being the right person for the surgery. And it's both. Yeah. You could be the right person for the surgery, but be doing the wrong surgery, and it wouldn't work.
Yeah, that wouldn't work so well. So yeah, there's value in being specialized in medicine, and
Yeah.
I think we have to make the right decisions and taking the best approach we can with the patient's best interest in mind, and get them involved with the right person at the right time and in the right scenario.
I agree. Thank you so much.
Yeah.